The vast majority of yoga positions are very safe for your eyes, but there are 5 yoga positions that can raise your eye pressure. This isn't a problem for everyone, but if you're someone who is at risk for glaucoma or you have a strong family history of glaucoma, you're going to want to know what these 5 positions are. Hi everyone, welcome back to the channel. My name is Dr. Saya Nagori. I'm a board certified ophthalmologist. I'm also a glaucoma specialist, and this is the iFacts.com channel. Today we're talking about the 5 yoga positions that patients with glaucoma should definitely avoid. And if you're not sure if you have glaucoma, you should get a full eye exam if you are considering to do these specific yoga positions. Now, before I get into this, I do want to mention that this video is for educational purposes only, so be sure to check with your personal eye doctor about how your specific yoga practices may affect your eyes. Also, it's important to note that yoga in general is very good for your body and your mind, including your eyes, especially the type of yoga that includes meditative practices. However, if you do have risks for glaucoma or you already have glaucoma, avoiding these 5 positions could be very helpful. Now, if you're a patient who has a healthy optic nerve, some increases in eye pressure are usually well tolerated because your optic nerve is very healthy. In patients who have weak optic nerves, like those patients who have glaucoma, the nerve could have a small insult because of temporary pressure rises during yoga. So let's get into these positions. So the first position that can raise eye pressure is downward facing dog. In this position, especially when you do it quickly, the pressure in the eye can go up because you're bending forward dramatically at the waist and putting your head beneath your heart. The second position that can also raise eye pressure is the plow pose. In this pose, the body is positioned upside down and your feet are over your head. This compression and inversion can cause a rise in eye pressure also. The third position that can raise eye pressure is when the patient is lying on their back and their legs are straight up against the wall. Blood flow is directed towards the head, which can also raise eye pressure. The eye has blood vessels called episcleral veins. They are located near the outer surface of the eye, and they drain blood from the eye's internal structures. The aqueous humor is also drained, and the production and drainage of aqueous humor is what glaucoma medications try to control. Under normal circumstances, the aqueous humor is going to flow from inside the eye through a structure called the trabecular meshwork, and then it's going to exit the eye via the episcleral veins. When your head is below your heart, like in these inverted yoga positions, the blood flow towards the head increases. This will then raise pressure in the episcleral veins. Elevated episcleral venous pressure directly raises eye pressure because the outflow of the aqueous humor is going to be restricted. So the higher episcleral venous pressure can create sort of a back pressure that makes it harder to drain the aqueous humor and makes it harder for the aqueous humor to exit the eye, which causes the pressure to rise. Okay, so now that that's explained, let's get back to the 4th and 5th yoga positions. The 4th position is standing forward bend. In this position, you're bending down at the waist and your face is looking at your shin. Again, because your head is below your heart, this raises eye pressure. And finally, the 5th position, which I'm sure is pretty obvious at this point, is going to be doing a full headstand. A complete inversion is definitely going to raise your eye pressure. The good news is, in the vast majority of cases, your eye pressure will return to normal within a few minutes of doing any one of these positions. This is pretty acceptable for healthy patients with healthy nerves and for patients who do not have glaucoma. However, if you do have glaucoma, especially if you have advanced glaucoma or moderate glaucoma, even these temporary spikes in eye pressure can potentially contribute to further optic nerve damage. This can especially be concerning if you're someone who practices these inversions on a daily basis. This is why it's so important to let your doctor know what types of exercises you are doing, especially if you're doing any inversions. So what can you do if you still want to practice yoga and protect your vision? Well, first of all, you want to limit the amount of inversions that you're doing and the positions that you're doing in which the eye pressure can be higher. Secondly, you also want to consider holding these positions for a much shorter period of time so that the eye pressure is not high for very long. Finally, it's really important to get glaucoma tested and get tested regularly, especially if you're at risk or you're a glaucoma suspect, because it's important to see if your yoga practices are actually affecting your optic nerve. Yoga in general does have many health benefits, so you can do yoga, but maybe avoid these positions if you do have problems with your eye pressure. Hope you found this helpful. Remember to subscribe below, and I'll see you in the next video. Thanks for watching.